Welcome to DMG TV2's Medical Minutes. This month, we talk about colorectal cancer screening and kidney disease, two very important topics, and we'll have information that you need to know. Our first guest is Dr. Matt Phillips. He's a surgeon with Trinity Hospital, Twin City, and he'll tell us what he finds in colorectal cancer screening. Then Dr. Michael Gigax is here. He's a Dover urologist and tells us all about kidney stones. Finally, we'll have Dr. Anthony Degenhard. He is a nephrologist in both Dover and Canton, and he tells us why it's so important to take care of your kidneys. It's all coming up next on Medical Minutes.
A nursing home or your own home, it's good to be home. So call Ember Complete Care for all of your home health needs. When you're recovering from illness or injury, our compassionate staff promotes healing in the most comfortable environment of all, your own home. For skilled nursing, physical therapy, wound care, and more, Ember Complete Care serves all of Tuscarawas, Coshocton, and Harrison counties. Call 800-462-0909. Ember Complete Care. It's good to be home.
For chronic sinusitis sufferers, the idea of going to the hospital for invasive surgery may deter them from getting help. But thanks to Dr. Kurt Guerin, ENT, those days are over. Dr. Guerin is the first ear, nose, and throat specialist in Northeast Ohio to regularly offer balloon sinuplasty right in the comfort of his own office in Dover.
Welcome back to DMG TV2's Medical Minutes. I'm again Jennifer Clark, and with us on this segment is Dr. Matt Phillips. Thanks for joining us.
Sure.
He has a practice at the Dover Outpatient Surgery as well as Trinity Hospital, Twin City. Welcome to Medical Minutes.
Thank you.
And your specialty is what we are emphasizing this month on colorectal cancer screening. Very uncomfortable topic. No one wants to talk about colorectal screening. So first off, explain a little bit about what you do. What's a typical day for you?
I'm a general surgeon that does endoscopy. So I do colonoscopies for colorectal screening. A gastroenterologist is a internist who specializes in endoscopy. So either of those specialties will do screening procedures.
So it all involves your intestines.
A lot of it, yeah.
And no one likes to talk about that.
No.
So why is screening so important?
Screening for colorectal cancer is so important because it's such a prevalent disease. It's the number 2 cancer killer in the United States. And the one important fact is that it's preventable. It's a cancer that we can actually prevent by screening colons and keeping a colon free of a polyp, which is a precursor to development of a colon cancer.
So polyps are little growths.
They're little growths that grow on the inner lining of the colon, which is exactly where we're at when we run our scopes and are evaluating the colon for colon cancer.
Now, if it's such a serious disease but preventable, how can you prevent it?
The key is the screen. The key is to have your colonoscopy, usually starting at age 50, although there are circumstances where we would screen a colon earlier than that. With the idea that if we can keep that colon free of polyps, you cannot get colon cancer.
Now, if you find a polyp, what do you do?
If you find a polyp that lends itself to removal with the scope, and most of them do, you remove it by either grabbing it with a pair of forceps that is designed to go through the scope. It comes out the end of the scope. You can see your forceps. You grab the polyp and remove it. We also use...
So you don't have to cut them open?
No, not usually. A lot of polyps are removed with electric snares. We lasso them and tighten up the noose and hit them with an electric current as we cut it off, and that prevents bleeding from the site.
That requires a lot of skill. And do you have a little camera to show you what you're doing?
Well, the colonoscope is a camera system. It's a 6.5 foot tube with fiber optic capabilities. It's a it's a very flexible instrument that has a steering mechanism that allows you to go into the colon and maneuver through all the turns. And when you find a polyp, you kind of line things up, pass the instrument that you're going to use to remove the polyp, and you'll see that instrument come out in front of you where it's in full view, and then you remove the polyp.
Now, you're talking about this with a straight face, but it sounds really uncomfortable, even just a screening. Do you use a general anesthetic and put your patients out completely so they don't know what's going on?
Yes.
Thank you.
The type of anesthetics we used to use what they called a conscious sedation, which is where the operating surgeon would have the nurse who's assisting you pass sedatives to the patient as you were doing the procedure, and you would try to keep them on a comfortable zone, so to speak. The anesthetics that we use now tend to be deeper. There's going to be an anesthesia provider dedicated to monitoring the patient during the procedure. That allows the surgeon to concentrate on the procedure. The anesthesia provider can keep the patient basically asleep. The patient will have no recollection of the procedure, will be in no discomfort whatsoever.
And we're talking about prevention by screening. What are the risk factors? I mean, who's most at risk for colorectal cancer?
The number one risk factor for colorectal cancer is your age. There's going to be very few cancers detected before the age of 50. Now, there are some exceptions to that general rule. The second most common risk factor is a personal history of colon cancer or a personal history of polyps on a previous exam.
But a family history? You know, say
where
your dad had colon cancer, does that make you more susceptible?
Yes, it does. There are some genetic traits that are exceptionally high risk for development of colon cancers, but a family history in itself will move your screen age back to 40.
And how do you convince people to get the screening? Just because, boy, this is a really serious cancer? Or how do you get them to come in? Because it doesn't sound like anything I want to do.
Most people come in requesting the procedure because they know someone, or there's a family member that has been stricken by the disease. They hear enough that they know that perhaps they can do something to prevent that from happening to them.
And does it take very long?
A colonoscopy typically is 20 to 25 minutes. Some colons, a colon's about a 6-foot tube. Some are harder to negotiate than others. And then, depending upon what you find, if you find, say, several polyps, well, it's going to add some minutes to the procedure in order to remove them.
So during your screening, if you find a polyp, you can take care of it right away, or do you have to come back later?
What we like to do is we like to deal with everything we can at the time of the screening procedure. Now, occasionally you'll run into a polyp that is of such size or of such a location that it cannot be removed with a scope. At which point what you do there is you document the location of the lesion and with the idea that that patient may well go to an operation in order to remove that polyp. Most polyps, though, can be removed at the time of the initial procedure.
So it's very important to have colorectal screenings, and you can just call your primary care physician or call any general surgeon and say, it's time for my screening.
Right. You can go, most primary care will refer you. They'll see that you've hit that age. They'll have you lined up to be evaluated for the procedure. But a patient can come in without a referral to be evaluated and eventually be scheduled for the procedure.
All right, well, good to know about Colorectal Cancer Screening Month. Our guest, Dr. Matt Phillips from the Dover Outpatient Surgery Center, as well as Trinity Hospital, Twin City. And thanks so much for joining us and
Sure.
giving us this great information.
Thanks for having me.
For chronic sinusitis sufferers, the idea of going to the hospital for invasive surgery may deter them from getting help. But thanks to Dr. Kurt Guerin, ENT, those days are over. Dr. Guerin is the first ear, nose, and throat specialist in Northeast Ohio to regularly offer balloon sinuplasty right in the comfort of his own office in Dover.
Looking for ways to get a return on your marketing investment? Get results with Digital Marketing Group. We provide a digital marketing solution with state-of-the-art opportunities to increase your visibility in the community, optimize your digital presence, and maximize your marketing investment. We specialize in affordable websites, custom mobile apps, search engine and social media optimization, high-definition video production, broadcast television. If it's digital, we develop it. If you're looking for a way to increase your profitability, obtain new customers, retain current customers, and get the return on your marketing investment, then go digital. Get results with Digital Marketing Group. A nursing home or your own home, it's good to be home. So call Ember Complete Care for all of your home health needs. When you're recovering from illness or injury, our compassionate staff promotes healing in the most comfortable environment of all, your own home. For skilled nursing, physical therapy, wound care, and more, Ember Complete Care serves all of Tuscarawas, Coshocton, and Harrison counties. Call 800-462-0909. Ember Complete Care. It's good to be home.
Welcome back to DMG TV2's Medical Minutes. I'm Jennifer Clark, and on this segment we have Dr. Mike Gigex. Thanks for joining us. And tell us a little bit about what you do. You're a urologist.
That's correct. I'm a urologist, so I'm a surgical kidney specialist, as opposed to a medical kidney specialist, which would be a nephrologist.
So what do? You cut people open?
Well, we do all different types of procedures on the kidney, including the bladder and prostate, and then also in men, penis and testicles.
So serious internal organs that you take care of. And since it's National Kidney Disease Awareness Month, we're going to focus in on kidneys. And we have two kidneys. Why do we have two kidneys?
Well, I guess that's the way we were made. God gave us two. In general, we only need one, but we have two.
And one of the more common problems with our kidneys is kidney stones. What are kidney stones?
Well, kidney stones are, truthfully, they're stones that form within the urinary tract. They start up in the kidney and then they can work themselves down in the tubes, and that's when they tend to cause a lot of pain and suffering.
And they can be all different sizes.
Yeah, they can.
Obviously, the bigger the stone, the more pain you're in.
It's actually not true. A lot of people with really large stones don't know they have them until they have recurrent infections or they have some other problem that they just crop up. It seems like the small ones are the ones that really create a lot of pain.
Is that because small stones, you can pass those and they'll move more than a larger stone?
It probably has to do with the rapidity with which they pass through the tract, but I don't know that it's ever been proven that a small stone causes more pain than a large one, though.
And when they form, what are they? Just calcium buildup?
Most stones are made out of calcium and oxalate, so those two elements bind together and form a calcification.
And they form because we have a poor diet?
The biggest factor probably is having concentrated urine, and so not drinking enough or being dehydrated. Also, there are certain foods that can contribute to kidney stones.
Like what?
Well, the five big things we think about are tea, which isn't really a food, but tea is bad for kidney stones. Nuts are bad, chocolate, berries, And then also really dark green leafy vegetables like spinach and collard
I
greens.
thought all of those were good for you,
Yeah, they're
but not good for stones.
bad for stones, that's right.
And who's most susceptible to having stones?
Anybody can get stones, even babies can get stones. Usually they're on medications that kind of contribute to that, but people of all ages can get kidney stones.
So anyone can get them for any reason, don't eat healthy food?
Generally, the biggest factor is not drinking enough fluid, and water is certainly the best thing to keep the urine dilute.
So how much water should you drink?
It's variable and it depends on what you're doing. So in the middle of the summer when you're outside and active in gardening or whatever, you need to drink a lot more than you do in January when you're sitting around inside the house. It's interesting that your body really gives you feedback every time you urinate on how you're doing with your hydration based on the color. And you really want it to be fairly clear. So if your urine is dark yellow or amber, there could be some blood in it for one thing, but also that's a sign that you're really dehydrated and your kidneys are trying to hold on to as much water to keep your blood pressure up. But as a consequence of that, your urine is very concentrated and that's when stones can form.
When do you call the doctor?
Well, usually you end up going to the emergency room when you find stones, when you have a stone because you're having severe pain. Usually in one side or the other of your back, it would be rare to have it right in the middle of your back with kidney stones. So a lot of people with stones present to the emergency room because of the severe pain.
Wow, so you have no idea until you're in so much pain that you go to the emergency room. There's got to be
Unfortunately,
another
that's
way.
true. Well, we do pick up kidney stones through blood in the urine. So you go to your primary care doctor for your annual physical and they check your urine and there's a few red blood cells in it, which prompts a workup, and sometimes we find it through that.
If you have a kidney stone, do you have to just pass it? Is there another treatment?
No, there's lots of different types of treatments, and it kind of depends on the location of the stone. So if it's sitting up in the kidney, typically we do lithotripsy, which is where we break it up with electromagnetic energy.
So like shock waves.
Shock waves, right. And we used to put people down in a bathtub for that, so a lot of people are familiar with this bathtub treatment. It's progressed now, fortunately, so that we don't have to use the bathtub anymore.
And is that what most people choose?
Yeah, I would definitely say that because it's totally non-invasive. So there's no cutting, there's no scopes. We do it in the operating room and you're asleep during the procedure. But that's primarily so that it is painful, but it can be done with sedation. But if you move, then we end up having to use a lot more x-rays, and so you have a lot more radiation, and so it's usually best to just put the patient to sleep and have them lay there.
And how often do you do that?
Well, usually at least a couple times a month.
Wow. So there's a lot of people with stones out there.
A lot of people with kidney stones, that's right.
Now, is there any way, like you said, to prevent it? I mean, we talked about your diet and just drink as much water as possible. Is there like a family history where, well, my sister had kidney stones, so I'm going to have them too?
Not necessarily. Diets certainly can run in families, so people learn to eat, in a certain fashion. But I should qualify that statement that you don't need to just drink as much as possible. You should, because again, you kind of have to adjust your fluid intake based on what you're doing and how active you are and how much perspiration you're having.
Should you just drink water, or can you drink any fluids? Juice, milk,
Water is probably the best thing. Lemonade is also good for prevention of kidney stones. So there's a product in our urine that's called citrate, and that actually prevents kidney stones, and some people are low on citrate, and we can do testing to determine that, and so sometimes we just prescribe lemonade, that they drink 2 quarts of lemonade every day.
2 quarts of lemonade a day. That's
2
a
quarts.
lot.
It is a lot.
And will a stone reform?
There's a very high risk of recurrent stone formation. When you have your first stone, if you just go on about your life living, you don't make any dietary changes or changes in your fluid consumption, you have a 50% chance of having another kidney stone. If you make changes, though, you can reduce that to probably about 7%.
So how do you get your patients to make changes? Because they won't want to, do they?
Most patients don't want another kidney stone, actually. So
So there's motivation.
There is some motivation there. That's right. Also, salt is bad for kidney stones, and the American diet is loaded with salt. So that's something to pay attention to. And then a really high protein diet is also bad for kidney stones because it makes the urine more acidic, which can kind of contribute to stone formation.
Wow, great information about kidney stones. Like you said, some of these healthy foods may lead to it, but the more fluids you take, the better you are. And if you have any questions, of course, call your doctor, right?
Right.
Very good. Dr. Mike Gigax has been our guest on Medical Minutes here on TV2. We will have more to come.
A nursing home or your own home, it's good to be home. So call Ember Complete Care for all of your home health needs. When you're recovering from illness or injury, our compassionate staff promotes healing in the most comfortable environment of all, your own home. For skilled nursing, physical therapy, wound care, and more, Ember Complete Care serves all of Tuscarawas, Coshocton, and Harrison counties. Call 800-462-0909. Ember Complete Care. It's good to be home.
For chronic sinusitis sufferers, the idea of going to the hospital for invasive surgery may deter them from getting help. But thanks to Dr. Kurt Guerin, ENT, those days are over. Dr. Guerin is the first ear, nose, and throat specialist in Northeast Ohio to regularly offer balloon sinuplasty right in the comfort of his own office in Dover.
Welcome back to DMG TV2's Medical Minutes. I'm again Jennifer Clark. In this segment around, we have Dr. Anthony Degenhardt. He is a Dover and Canton nephrologist. So we're going to have you explain what a nephrologist does.
All right, thank you for inviting me. A nephrologist is a special doctor that specializes just in the kidney disease, and generally speaking have training first with what's called internal medicine, which is a residency which you do right out of medical school. And then after your residency, you do a specialty fellowship for 2 to 3 years learning just about kidney disease.
And what do kidneys do?
The major functions of your kidney are as follows. Number one, as most people will know, they help to make urine, to get rid of fluid. Okay, most people will remember that one. And they also,
I think so.
They also remember problem number 2, which is filtering the blood purification, cleaning the blood so that you don't get sick. Everything that you eat, ingest into your body is broken down by the liver and the kidney. And the kidney filters everything. So if those wastes back up, you'll start to feel sick. Now the 3 other things that people don't think about too much about the kidney is they help regulate your electrolytes. These are things like sodium and potassium and acid in your blood, not in your stomach, but acid in the blood. The kidney has special cells that make that. It also helps regulate your bones through calcium and phosphorus and vitamin D. Vitamin D that you take in from the environment through sunlight or through dairy products is converted by the kidney.
They're busy. They have a lot to do.
That the kidney can use. And the 5th thing, that major thing, is it regulates your blood count, what's called anemia. There's special cells in the kidney that tell the bone marrow or the part of your body that makes red blood cells to make more red blood cells. But the 2 most important are the first 2 that I said, which is getting rid of fluid and purifying the blood. Because without those 2, you will get very, very sick and very quickly.
And since this is National Kidney Disease Awareness Month, what kind of diseases can you get in your kidney?
Well, the 2 most common in our country are number 1, diabetes, which makes up approximately 40% of all cases. And then number 2 is hypertension, which makes up another 35%.
High blood pressure.
High blood pressure. And both of which are very prevalent and can be treated. Now, the remainder of the diseases can be broken down into not very common diseases, but some of the genetic or inherited diseases would be what are called polycystic kidneys, which is a very common disease that people will inherit from their parents, and usually there'll be a family history of that. And that is picked up through radiology, through an ultrasound or a CAT scan. And then the other one is what's called IgA nephropathy, which is another kind of disease, which is also inherited, but there'll usually be some genetic link with that one as well. And then some of the less common ones are what they call vasculitis, which is a inflammation throughout your entire body, which then attacks your kidneys, can attack your lungs. And then there's other disorders which are called autoimmune, which attack yourself. It's your body attacking yourself. And the most common one that people think of with that is what's called lupus. And then trauma, infections, these are less common, but these are ones that can affect your kidneys function. The most common one, though, is diabetes, by and far, and it's the most prevalent, and it's increasing.
Why is that?
Because we are becoming more developed nation. We aren't doing things like we used to. We eat a lot of prepared foods, which has led to an epidemic of diabetes. We're even now seeing this in children. And so if left untreated, diabetes will start attacking and affecting the kidney. This is picked up through a blood test.
That easy.
That easy.
So you can diagnose just about any of these diseases that you mentioned just through a blood test?
Initially, you would get a blood test and a urine test, and then more testing would need to be done, usually with just blood tests. Very rarely do we have to do what's called a kidney biopsy, is where we get tissue out of the kidney itself. Generally speaking, we can get most of this information through a urine and blood testing.
Now you mentioned family history is a pretty strong risk factor. Anything else that might indicate, I should get my kidneys checked out?
Well, if you've been diabetic for more than 10 years, or you've had hypertension or high blood pressure for more than 10 years, you definitely need to be checked to make sure you don't have any early signs of kidney failure. Because the earlier you treat it, the less likely you are to progress to the different stages of kidney failure. There's 5 different stages of kidney failure, 1 through 5, and 5 is the worst. These are based upon the blood work that you get. One of the particular markers in the blood work is called creatinine. It's a marker of how well the kidneys are cleaning. Low is good, high is bad, and a normal is about 1. And you get some reduction in that number as you age naturally.
And can you treat that though?
You can. So if you have diabetes, the number one treatment is blood pressure control, and strict blood pressure control. You know, patients will come to you and say their blood pressure is fine, but fine means what? Well, fine should be 130 on the top number, over 80 on the bottom number. These patients will live longer and they will have less chance of progressing to the stage 5 kidney failure, which is the people who need replacement of their kidney function. Number 2 for a diabetic is blood pressure, or blood sugar control. They need to have their monthly blood sugars monitored closely, as well as their 3-month sugar check, which is what's called a hemoglobin A1C, and their primary care doctor or their diabetic doctor would be checking this every 3 months. And that number should be around 7 or so to protect the kidneys.
This sounds all really complicated. There's a lot of information. So like I mentioned, your kidneys are very busy taking care of a lot of your functions. When do you go see the doctor? I mean, do you have physical symptoms that you need to go?
That's the problem with kidney failure. It's a silent killer until it's too late. So once you get the symptoms of what we call uremia, which is feeling tired, itching, not wanting to eat, especially meat products, very fatigued, shortness of breath, you start to get swelling in the body, legs, lungs, abdomen. It's too late at that point. So you really need to follow with your doctor on a regular basis. And if you have any risk factors for diabetes and high blood pressure, you should be seen at least twice a year at a minimum, sometimes more. And yearly you should have your protein checked in your urine, because protein is a marker of bad things to come, not only for your kidneys, but for your what we call cerebrovascular system, which would include your brain, your eyes, your kidney, and your heart. So people that have a high level of protein in their urine, they're at a much increased risk for stroke, heart attack, and kidney failure.
Wow, all of that just
That's
from your kidneys.
from a simple test too, just a simple urine test.
So definitely go see your doctor and
And
make
locally
sure.
here in town, the Kiwanis has a screening once a year where they check these things. So even if you don't have a doctor or can't afford to go to a doctor, I would highly recommend seeking out that program so that you can see.
Fantastic. All good information to know. Our guest on this segment, Dr. Anthony Degenhardt. He is a nephrologist in Dover and Canton. Thanks for being on DMG TV2's Medical Minutes, and I'm Jennifer Clark.
Thank you.